My first question for you today is what's new in your practice or institution this week, given the rapidly evolving COVID-19 crisis?
So that's a good question because every week seems to be different as we're dealing with the COVID-19 pandemic. And I'll say that what's interestingly noticeable this week in my practice is that I think we've somewhat adapted to the new routines, which are including more telehealth visits, less in-person visits, and really knowing that we're trying to minimize the risk of exposure for both our patient and our staff, and having the consciousness around each other when we're in clinic, whether it's with patients or with staff, that we know we need to acknowledge the social distancing. And I think we're all a little bit more in a routine this week. So I think that's a positive aspect.
Okay, great. And then do you think you could expand on some of the measures that have been put into place at your institution to prevent the spread of the virus?
Sure. So I think like many institutions, again, the concern is that we want to be able to take care of patients who have current medical needs in addition to the influx of the COVID-19 patients who have new types of medical needs. And we want to balance that so that our current patients and our patients who have medical conditions outside of COVID are still acknowledged and getting the care that they need. And that being said, we really need to protect our staff and our patients and anybody who enters into the hospital complex or into the clinics. We need to protect them from any types of potential exposure to COVID-19 and make sure that everybody stays healthy and safe. So in doing that, we have temperature screenings for all people that are entering the clinics and the hospital complex. Everybody is wearing mandatory masks. I'm not wearing mine right now because it would be hard to talk to you with it on, but I'm in my secluded office. But when we're walking around on campus, we are wearing our masks. And that goes with patients in addition to staff and physicians. And then there's a very limited visitor policy. There's essentially no visitors, and then there are some criteria that some areas that visitors are allowed, but it's really minimizing all that exposure and also preserving the PPE, the personal protective equipment. And so because everybody needs to be protected, by limiting the number of people who come through, we preserve that.
Great. And I know you kind of mentioned this a little bit in your first answer, but so you mentioned telemedicine. So do you think you could expand upon that a little bit and talk about how you're using that in your practice?
Sure. So we've all been interested in increasing telehealth or telemedicine in our practices. And there have been times in the past where we were potentially interested in maybe talking to a patient and having that count kind of as a care visit, but we really didn't have methods for doing that. Having the COVID-19 pandemic and the need for social distancing and protecting our patients, it's really moved telemedicine and telehealth into the next wave. And so we are now, any patient who is not needing a in-person visit for an infusion or for severe symptoms, they will get a telehealth visit, whether it's by video or telephone, and we will assess symptoms and go through side effects, go through issues. And it also serves as a touch point for the anxieties and worries that are occurring in this moment in time. And so I think it becomes a very important type of visit that we can stay in touch with our patients at this time when things are rapidly changing and causing a lot of anxiety.
Perfect. So what data have we seen so far that could show what patients are most at risk?
So what we know about patients who are most at risk, specifically speaking toward cancer, we know just a little bit, and there's a little bit that has come from China and a little bit that has come from data in Italy. that we know that overall there is some higher risk in patients who have cancer, specifically patients who have had recent surgeries or recent chemotherapy. But the numbers are incredibly small. There's also data from China to say that, or from the group in China that says that patients who are getting ongoing therapy may be at more risk, and that may be because they're in the system more often. But again, the numbers are so small, it's hard to make generalizations from that data. But what we do know is that patients who have other comorbidities are potentially at risk to have more complications and more severe side effects or more severe symptoms associated with coronavirus. So though these patients are in need of therapy often, they're also at higher risk for potentially developing more severe consequences. And so we must balance that very specifically for every patient.
Now, do you find that lung cancer patients are more at risk than the average patient with cancer?
So at this time, again, I think it's hard to tell. Some of the data suggests that maybe they are, but it also may be the patients who got screened because they had cough and shortness of breath. Of cancer patients, they're more likely to have the symptoms that are associated with some of the respiratory parts of coronavirus. So it's hard to know if that's true. And again, these numbers are incredibly small. You're getting into kind of single digits as you're going into some of these risk factors. So I think any patient who is receiving treatment, who has compromised lung function, just needs to be careful because the consequences and the type of syndrome that they may get with coronavirus may cause more serious consequences for them.
Now, are you experiencing any delays in molecular testing during this time? And what are you doing for those patients whose results are taking too long to come back?
At this point in time, I haven't experienced delays. Speaking in general, there's a lot of back and forth about, when does a patient need to be treated? Do they need to be treated with cytotoxic therapy that might compromise their immune system? And every patient and every decision is really quite unique and really requires a lot of discussion and deliberation because, again, we don't know when this will end, when we'll be able to kind of join more usual daily practices. And so as we're trying to balance the caution of cancer care and cancer treatment versus potential COVID-19 infection, each discussion becomes very personalized for each patient with their treating physician.
And then personally, what is the latest challenge that you've experienced with regard to COVID-19?
So I think that the biggest challenge, and it may be for all of us, is the uncertainty. The uncertainty in how long this might last, how severe it might get, whether we'll know when we're past that certain point where we can, again, join society and kind of go back to whatever daily life should be. And so that uncertainty, again, is compounded when you're dealing with a cancer diagnosis and dealing with whether you should move forward and go forward with a intervention, diagnostic, therapeutic, of any sort, or potentially delay it, and how do you make those decisions? And so that becomes the biggest challenge. If somebody needed to wait for 2 weeks to get a biopsy or something like that, that may be acceptable. If this is going to go on for 8 weeks, that becomes a little bit less acceptable. And so we're constantly weighing that, and that is a daily challenge that we deal with.
Okay, and then I know you kind of mentioned this before, but are you experiencing any supply shortages such as personal protective equipment?
We are not experiencing any shortages and have enough personal protective equipment at this time for the care of our patients. And I will say our institution has constant has meetings and is putting policies into place and evaluating the situation on a constant basis.
That's good to know. So are there any ongoing research efforts that you're finding particularly exciting?
So I would say at this time we are involved in research, and we will have a press release from our institution probably within the next day that you can get more information.
Okay, great. And then my last question for you is, what do you feel is most needed to quell the COVID-19 pandemic?
So at this time, again, obviously a vaccine would be spectacular. That's a more longer term goal. At this moment, we need patience because we're being asked to do things that are not usual for us, and it's really for the better health of us and our society at this moment. That takes some somewhat altruistic mindset and patience to do that. We need to cooperate together, to work together, and we need a lot of compassion for everybody out there, knowing that we're all under more stress than we've ever been before and more uncertainty. And so I think those three things will help us get through until we get to the point where we have things like vaccines and other treatments that might help us fight this in a more effective way.
Perfectly said. Thank you, Dr. Reckamp, so much for your time today. It was great speaking with you again, and just thank you.
Thank you so much. Have a good day.
You too.
Stay
Bye.
safe.